morning, ladies and gentlemen. Welcome back once again to the Weekend Wellness Workshop. I'm Dr. Dennis Courtney with you today, as I am each and every weekend. Saturday and Sundays, we're here with you 10 to noon, discussing a unique way to take care of your health and receive and achieve optimal health without drugs or anything invasive going on at all. In keeping with that pledge, and we keep bringing you new topics each and every week, many of which you've never heard about before. Take the time to learn more about them, become involved with them. You'll be so much happier that you did for whatever malady that you may be trying to get corrected through your conventional doctor, and it's just not working. At best, he's using a drug to help you alleviate your symptoms, but he's never fixing the problem. I found that to be the problem with my dear medical art, and for that reason have been doing alternative work for over the last 20 years. One of the unique therapies that have come my way over this time frame was immediately identified me as something I wanted to be involved with. Allergies plague an awful lot of people. And we have folks that are devoted to treating allergies. They're called allergists. And I had the opportunity one day to actually meet an allergist and ask him some questions. And that's usually a difficult hoe for whoever is allowing me to ask them questions, because I'm always interested to find out things that I don't know about what they do. And the questions are very probing, and I usually can get amazing information that I've never gleaned before. Well, when it came to allergies, I spoke to this allergist and I said, you know what, could we have a talk? And he said, why, sure, Dr. Courtney, why? Let's just go right ahead and fire away. So he said, well, let's start this way. There are two kinds of allergic response. Would you agree with me, doctor? And he said, well, what do you mean? And I said, well, there are immediate hypersensitivity reactions. That's one category. And there are delayed hypersensitivity reactions, which are another. Now, he said, you know what? Yeah, that's exactly correct. I agree with you. There are these two basic ways that the immune system can respond. So I said, with respect to the immediate hypersensitivity reaction, I go, as an allergist, what do you do? Now, folks, at that point, this gentleman sprung into immediate action. If he would have had wall charts and a PowerPoint presentation, I'm sure he would still be talking to this very day. I mean, the gentleman was on cue, and he began to describe how he, an allergist, treats such things. But as I was listening, I learned a couple of things I didn't know before. Let's see if you know them. The first is, I found out that the only thing an allergist can treat is an allergen that is an inhaled one. So if it's something in the air and you can breathe it in and it can trigger an allergic response, let's say an asthmatic response, sniffles and sneezing and whatever else, there's a good likelihood that the allergist is going to be able to help you out there. However, if it's any other material or substance, the allergist can't do a thing, not even allowed to. So I'm thinking of all the foods that might be involved with allergic response. And then to learn that they can't do anything about foods sort of caught me by surprise. I didn't expect that. And when I asked them about chemicals, I learned the same. So maybe the take-home message is, with inhaled allergies, you might want to start with your allergist. But let's find out what he does. Now, the first thing an allergist does is to test you. You're the testing ground. And then he uses various allergens. He does skin testing, sometimes hundreds of skin tests. And then he's looking to see how you react to certain substances, which are absolutely indicating that you have an allergic response to them. And once he tallies up all of those responses, he will then make a serum with you in mind, your issues particularly in mind, and at a dilution of 10 to the 5th. I want you to appreciate this. I think it's a big deal, because that means he's got 5 columns of water in front of him. And they each have 10 milliliters of water apiece in them. And he takes in the first one and puts 1/100th of 1 ml into the first vial, and he shakes it up. Now he takes from that one 1/100th of 1 ml from that just recently diluted solution, and he puts that into the second column of water, and he shakes that up. And then he takes you get in the picture now, he takes 1/100th of 1 ml, puts it in the third, and then to the fourth, and then to the fifth. That is a dilution of 10 to the fifth. And one would think, well, my goodness, by the time you've diluted it that much, there's really nothing in that thing. Well, let me tell you about nothing in that thing. And unfortunately, there's a whopping dose of that allergen in that thing. In fact, it's so whopping, there are cases where people have died in an allergist's office receiving a injection into the skin, in the sub-Q rather, with a 10 to the fifth dilution. That's very rare, but it is a whopping dose to some. The second thing he'll do is once he puts your mixture together with the various allergen tube with skin testing, that are all at the dilution of 10 to the fifth, he then injects the solution underneath the skin into the subcutaneous arena, and in that arena, you will get a response of your immune system to develop antibodies against whatever was in the serum. Now, these antibodies do prevent follow-up reactions against those allergens. So in a sense, a mission's really accomplished, and a very unique mission, you would agree. Here's my problem with it. When you inject into the subcutaneous tissue, you get the formation of antibodies, and these antibodies live for only 14 days. And you have to come in with another injection before the 14 days is up, and this sets up a relationship with your allergist that you're going to have by seeing him weekly, every week, for the rest of your life. And to me, although I'm sure there are many people that think that's wonderful that you have an allergist that can help you out like that, I think it gets rather old. These gentlemen and women become part of the family. They are more than just a casual acquaintance. Now, taking what I've just said, let's compare it to something called LDA. Introduced in this country in 1993. The godfather of LDA in this country is named William Butch Schrader. And you're going to be able to hear from Butch with an interview we put together this week, and I hope you enjoy it. Now, Dr. Schrader's technique involves the following. Number one, there are 3 mixtures that will and can be used. One group of them are called the inhaleds, another group are called the foods, and another called the chemicals. So right off the bat, you can actually treat all of the possibilities so you do have an allergic response. I thought that was the first big change. The fact that each of these mixtures have all the allergens obfuscates the need for testing. So in the inhaled mixture, every inhaled allergen known to man is in there. All the danders, all the molds, all the mites, you name it, the pollens, they're all in there. And when it comes to the foods, same thing. All the foods are in there. And remember, you couldn't even use foods when the allergist was at the helm because he's not allowed to use the foods. And they are also at a dilution of 10 to the 17th. So testing. Why? All of the potential allergens are all represented. And when these injections are given, they are not given sub-Q. They are given intradermal. And when you administer these allergens intradermally, a completely different reaction occurs. You see, there's a unique nervous system located in the skin surrounding all of you. The name of the nervous system is dendritic nervous system, and it is unique enough to be found every crook and cranny of your body surface. But there's one other thing about the dendritic system that's even more unique, and that is this dendritic system is literally hot-wired. You own. And the lymph node is the site of immune cellular response. And so consequently, once you put the mixture into the dermis, you get a tripwire response by having the lymph nodes make a cell against any one of the particular allergens that are a problem for you. And in so doing, this T suppressor cell, and the T suppressor cell prevents the formation of any of the bad guy cells, they're called helper cells, from even being formed. Now, uniquely, the half-life of a T suppressor cell is 90 days. That's the half-life. And so, right off the bat, there's another distinct difference between LDA and the allergist shots, and that is we don't have to give them every week. We give them once every 2 months and allow the half-lives to get so large that by the time we get to a year, we can really open up those injections. And you should be able to have eaten the foods that you couldn't eat before and inhale the stuff that you couldn't before, and even have chemical contact you couldn't before. Essentially, you are corrected, you are established, you are returned to whole, and you don't have allergic responses anymore. So look, we're going to be talking now with our good friend, Dr. William Butch Schrader. Hope you enjoy the interview. We'll come back in the second hour and I'll talk more about LDA, what to do about it, how to get it, how you can plan to come in our office to start your allergy correction in a way that's definitive. So take a short break. The news will be right back after that with our interview with Dr. William Butch Schrader. Good morning, ladies and gentlemen. Welcome back. Dr. Dennis Courtney with you today, and we have a special treat for you today. We're talking about this subject of immunotherapy and LDA in particular, low-dose antigen therapies. We've been doing it for over a year now with local talent, one Dr. Roy Carey, but the person, the individual, the source of all this information spills off of one gentleman. He is literally the inventor of a therapy called LDA. He is correctly referred to by me, at least, reverently, as the godfather of LDA. He is our guest today. His name is Dr. William Butch Schrader. I want to say good morning and welcoming to us and allowing us to interrupt his morning in Santa Fe, New Mexico at this early hour. Good morning, Dr. Schrader. Thanks for coming aboard.
Well, good morning, Dr. Courtney. It's nice to be here. Thanks for inviting me.
Oh, my goodness gracious. I was elated to hear that you would take me up on my request. Dr. Schrader, we have been talking about this therapy for as much as a year now. And I had the opportunity for the first time to meet you just a few weeks ago in a conference in St. Petersburg where I was really introduced to these concepts in a very in-depth way. Before we get to the actual discussion of LDA, which you certainly will be able to fill in many of the gaps that maybe I have left open, I'd like to hear a bit about yourself, Doctor. You're a physician, and if I saw it correct in your CV,
you started this all out as a surgeon. Could you give us a little bit of background in your medical prowess and the things that you've done leading up to what we're going to be discussing today?
Sure, Dennis. I started into medicine as a general surgeon. I trained at the Queens Medical Center in Honolulu, Hawaii. I had gone to Hawaii to do my internship because my sister had lived there, and I'd gone to visit her before that, and I liked Hawaii. So a friend of mine and I from the University of Tennessee went over there to do our internships and our further training. At least I stayed for that. So I started general surgery, but when I went into practice at a plantation on the Big Island, I practiced both general surgery and family practice, which included delivering babies and emergency room work and the whole bit. And during that time, I got interested in allergy because all these people were having problems and nobody was doing too much about it except giving medication. So I was very interested in trying to help these people some other way. So I ended up going to Honolulu and studying some more with a couple of allergists and went back and started doing allergy.
So that's why, I mean, that's a pretty sharp turn, Dr. Schrader, from surgery to moving into immunotherapies and allergy, but that's what you saw and that's what you had to treat, huh?
I think so. Surgery, is fun, but it's sort of end-stage medicine. You're getting there sort of after the barn door has been opened, and with treating allergy, and especially difficult problems that the regular allergists don't treat, you're really getting in on the bottom floor and actually preventing some bad things from happening.
Now, as you moved into the allergy realm, I'm going to imagine that you've probably delved into, or maybe really profoundly got involved with just about every immunosuppressive therapy, immunotherapy, maybe better said, allergic treatments that were possible. And so you've been working in this realm for so long. Sort of take us through the therapies that lead you to the creation of this newest therapy, the LDA. You've done every allergy therapy that there is, haven't you?
I have. I started out with scratch testing to inhalants only and started treating as a general allergist, which means basically you scratch test patients to the different pollens and dust and so forth, and you usually do that on the back. And I remember back in the old days, we used to make our own scratch testing needles by snipping off half of the eye of a surgical needle and sticking it in a rubber stopper into the vial so you'd have a scratchy end on it. But with that, you could only treat inhalant allergy, and it was escalating dose. You'd have to find out what the patient reacted to on their skin and then start out at an extremely low dose and then build up to higher doses over time. And it wasn't immediately effective. And it turned out that it worked pretty well for patients who had simple inhalant allergy. But most of the patients, I think that a lot of allergists probably see, that doesn't really help well enough. They have to continue to take medications. They have to continue to do almost all the stuff they had to do before, except their symptoms are a little better during allergy season. So it really doesn't suppress all the symptoms, and I started looking for other causes. And of course, once you start looking, you find them pretty quickly, and generally that opened up the whole realm of food sensitivity and food allergy.
So this thing about foods, Dr. Schrader, whereas the inhalant, which is a revelation to me, by the way, as a medical doctor, to find out that the allergist really only ever could deal with and continue even to this very day, deal with inhalant allergic responses only, sort of the immediate hypersensitivity reactions, never really getting involved at all with this category of the delayed, which the food category really occupies the vast majority of. there always, when I first had that revealed to me, I was shocked to think, hey, there's a group of allergies out there not even attempted to be treated by the allergy community. Wasn't that, I mean, to me, that was a revelation that I had never thought of before.
Yeah, it was to me, too. And I didn't realize it, of course, until I started practicing it and seeing that my patients, some were doing pretty well, others weren't doing well at all. And I happened to pick a meeting to go to called the Pan American Allergy Society, and went to a Pan Am meeting in 1978 and learned about all this food and chemical and things that are going on. And from then I joined Pan Am, and I also went to an Academy of Environmental Medicine meeting, and they were talking about all that stuff and teaching you how to do it. And of course, so was Pan Am. So I joined AAEM and began treating foods. And the method that they use at Pan Am and AAM is basically a method called provocation neutralization, where you test a food. The patient may or may not have symptoms or a growth of their skin reaction, and you actually find the exact dose that makes that reaction or their symptoms go away right at that moment. And then you put that in a vial with a whole bunch of other foods that you've tested, and patients then give those shots to themselves daily or every few days or once a week or however often they need it. And that worked quite well, except the problem with it was, of course, that it was very time-consuming. It takes a long time to test foods. If you want to be thorough, you really have to test a bunch of foods. And it's very time-consuming. The foods have to be retested at some regularity because patients' food sensitivities will change over time depending on how much of the food that they're eating. So I was really looking for a better way, because that way was, even though it was pretty effective, it was cumbersome, and there was no effective way to really treat the chemicals very well using provocation neutralization. So I was always looking for something better.
Now, it's apparent then that as you were searching for something better, you sort of were taking the benefits as they came and sort of had to live with what you really was outside the scope of being even possible. And then you, to jump forward maybe a number of years, finally meet a gentleman by the name of Dr. Len McEwen, and things really do take quite a turn at that point. You want to talk about that meeting and when you first met Dr. McEwen and how it was that you thought his therapy may bring a bunch of additional positive components to this treatment of an immunological response?
Yeah, sure. Len is probably the most brilliant clinical allergist I've ever met. He still practices, as far as I'm aware, in London. He lives in Henley-on-Thames in the UK. And I met him through Leo Galland. There's a physician by the name of Leo Galland.
Oh, yes. Very familiar with him.
Yeah. Has he been on your show?
Hasn't been on the show. I've listened to many of the shows that he has done. He's certainly not difficult to find. He's out there promoting when he does all over the place. Yes,
he's quite a character.
Yeah, well put.
And I didn't know him at all at the time. And I heard a tape of his at the point in time. There were tapes and not discs. That he had spoken at the meeting treating chronic vaginitis, allergic vaginitis, and he was using something called EPD, and he mentioned it just briefly on the tape, and I said, well, that sounds interesting.
EPD?
EPD. Yeah, which turns out short for enzyme potentiated desensitization. And he and one other fellow near him who he was sort of letting use the material was the only one in the country. He was the only one in the country in New York at that point using this method. And I didn't know anything about it, and I called him up out of the blue, and he was nice enough to talk to me. and told me what this was, that it was a great immunotherapy developed by an allergy immunology gentleman in the UK by the name of McEwen. And so Leo and I basically emailed Dr. McEwen and talked back and forth and got him to come over to a clinic called the Princeton Biocenter in Princeton, New Jersey back in 1990. The first course on APD, and there were about, probably 14 of us there, I think. I had told all my colleagues around the country who were interested in it. And so a bunch of them came, and we all learned how to do this. And it was really quite amazing. One of the very impressive things about it, to me, I recall, was that McEwen had done a bunch of research into autoimmune diseases, notably rheumatoid arthritis and ankylosing spondylitis, and was treating those with other components of this material, which were actually, as I'm sure you've talked about on your program, mixtures of various things in the air, inhalants, food. But there were also two bacterial components that he used at the time for treating rheumatoid and ankylosing spondylitis. And so basically, several of us from this first meeting started using it. It had to be shipped from England. We found out pretty quickly that that was not exactly legal. And so I started a review of a study that we put all the doctors into who were doing this. It was put under an institutional review board, or an IRB, in order to be legally supervised so we could import this material from England. And the IRB was an organization called GLACAM, a Great Lakes College of forgotten now, advancement in medicine, but it was very interesting. We had to report on it every year, and so we had to collect data. And as we collected more data, more doctors heard about this and became interested as I reported on the data at the GLACAM meetings annually, and also gave a few talks at the Academy of Environmental Medicine. So eventually there were about 100 docs in this study, and we ended up with about 10,500 patients. And that material's on my website. It has not been published yet. We're just now thinking of doing a little publication. But it was quite a miraculous method of treatment. I published a paper, I think it was somewhere in around 1993, about my limited experience with 142 patients at that time. And it's just, people got more interested over time, and now there are doctors all over the country that are doing it.
Now this treatment, I mean, here you were really treating pure classical allergy there on the Big Island, and maybe by the time you did matriculate here over to the mainland, but nonetheless, these were inhalant kinds of issues, and then you had to move into other forms to get the foods in there. But how about finally seeing that you could utilize an immunological approach to treat things like autoimmune disease? Wasn't that a major thrill for you to think, hey, we can treat from an allergic viewpoint conditions such as these? Wasn't that a great revelation to think that it was even possible?
It was, and McEwen never went into tremendous detail about the Proteus Klebsiella antigens that he was using. He had mentioned some things, and so I started doing my own research. And it turns out that the primary principle of the use of that is something called molecular mimicry. And all that means is simply that certain bacteria that can be found in the body have very tiny parts of them that actually are the exact same protein sequence as on a special receptor that all of our cells in the body have. And so diseases that are associated with that receptor, like, for example, there's a receptor called HLA-B27 that all patients almost with ankylosing spondylitis have. And this certain receptor has been associated in the literature with a bacteria called Proteus. And so this is how McEwen sort of figured it out. And by George, I had a patient, my first patient with ankylosing spondylitis, and I used this material, and it actually stopped his pain and seemed to stop the progression of his disease. So it was amazing. And in reading, I found out that there were several other associations at that time. Since then, there have been many more with other specific bacterial receptor sites that are of the HLA variety in the body. And so every autoimmune disease that has been identified with a receptor type is very likely to be involved in molecular mimicry. And there's very likely a material that can be used to treat it, either bacteria, a virus, maybe a food, something on that line, by specifically giving that as a separate part of the treatment. And since that time, I identified that Bacteroides, which is another bacteria that almost all of us have in our intestinal tract, is a large part of the anaerobic population, the bacteria that don't breathe air, is associated with reactive arthritis. So I got Dr. McEwen to produce a Bacteroides vaccine that was at a very specific dose, like all the other material that we used. And it seemed to work very well for patients where regular EPD, which is now LDA, didn't work. And it especially worked for people who had various types of arthritis that really didn't improve by treating their food problem.
Well, the fact that you and Dr. McEwen recognized that you could use an immunological approach to actually administer these bacterium to provoke certain responses. Let's talk about those responses, which I think are distinctly different as I now read them, and as you certainly did learn them to be, between, how is it that either EPD, by the way, let's do this first. EPD, these three-letter combinations drive us crazy sometimes in medicine. I'm sure they drive our listeners nuts. But EPD has morphed itself into something called LDA. EPD really has been derived by Dr. McEwen. LDA, that's your baby. How did that come about, and why did it need to come about?
Well, that's a good question. And it really came about because finally the FDA, after visiting my office every year, at least once.
The men with the black hats kept coming to see you?
Yes. They didn't bring their guns or anything, but they always send an investigator to my office to see what I was doing with this stuff. And after they found out enough times that what we were doing and that it was imported, they didn't like it. And so they got to the study that we were doing by shutting down the Institutional Review Board, which is a way that they can do things sort of behind the scenes. So once they shut down the IRB because it wasn't following protocol perfectly, and of course no IRB practically ever is, they can always find some fault with it.
This is that study, by the way, of 10,500 patients. Isn't that what you're talking about?
Yes, it is.
Huge study, by the way. This is a monumental study.
Yeah, it was pretty spectacular, and the results were really quite dramatic, I thought.
But they didn't like it?
No, they hated it because it didn't come from America, you know.
Ah.
It was manufactured outside the USA, and so that's the problem. It was not an FDA-approved material. So they closed down the IRB, and we were sort of left high and dry. And fortunately, over the years, Dr. McEwen had given the approximate concentrations of the material, of some of the materials in the vaccines that he was using, the foods and the inhalants, and even the bacteria. So I was really able to recreate at that point. This was it was about 2001, I think, that this all came down and the FDA made importing EPD illegal. And even though thousands of patients wrote letters to the FDA that they were having none of it, and because this wasn't FDA approved, they didn't want it out there. So we were able to recreate it here, and I got a lot of patient volunteers to try it because they were desperate. They didn't have their EPD anymore. And after a couple of rounds with making our own material, we got it pretty well perfected, and we had a compounding pharmacy do it who could do it on a much larger scale than I could. And so, excuse me. So basically, it sort of transposed itself into this new material, which I simply call low-dose allergen therapy, which is
LDA.
Yeah.
LDA. So EPD becomes LDA literally by consequence. It just couldn't happen any other way. The FDA shut down the free flow of the serum and the mixes to you from England. And when you keep saying we, I got to tell you, folks, very modest here, it was you who spearheaded this. This is truly your baby. I know that doctors were in there with you, but you took the lead on this one, Dr. Schrader, and you really need to be singled out as the father. You are the guy who originated LDA here, which now can flourish because, what, is it now recognized by the EDA? Is it legal here in this country now?
Well, it's legal, but it's not. It's still not recognized. Luckily enough, compounding is a very growing practice in this country, and compounding is really the way that pharmaceuticals started out. The doctor ordered something from the local pharmacy and said, "Hey, make this stuff up."
Hey, he mixed it. Yeah, more than a pestle.
Yeah, there were some patent drugs around, patent remedies, but if a doctor wanted anything other than a patent remedy, he had to have the pharmacy make it. So that's really the way it all started in this country. So now compounding is much more widespread, especially in past several years. It's grown dramatically. And the FDA does not like compounding. They make no secret of their dislike for compounding and they've set forth many rules for these compounding pharmacies, some of which are reasonable, others which are stupid. But nonetheless, they're rules that the FDA says that are out there, although they're not necessarily followed by all the pharmacies that do this. But that's the way that we got around this through compounding, and compounding now has gotten a bad rap, as you've probably heard.
Oh, with that New England group, yeah.
Steroid bit. And the reason that happened is that the material is a suspension. It's a sterile suspension of steroids. Methylprednisone probably most of the time. So, and that's very difficult for anybody to make. So there was a company that made it and stopped making it, and therefore there was tremendous demand for this deposited steroid with no manufacturer, and therefore it had to shift over to compounding. And since it's so hard to make, I think this one pharmacy who was making a lot of it had these problems. But without compounded stuff, people wouldn't be able to go get the steroid injections that they receive in their joints and their backs and so forth that are very common these days.
Well, that was still going to play itself out. It's pretty ugly how things can turn rotten when it comes to compounding.
We'll take a short break. Be right back in a moment.
Welcome back. Dr. Dennis Courtney with Dr. William Butch Schrader. He is literally the inventor of a therapy called LDA, the godfather of LDA. He is our guest today. LDA, which is low-dose antigen, if I were to ask you to define it, and I know you do this so well, how would you like to tell the listener, what is LDA?
Well, LDA is a mixture basically of everything but the kitchen sink that we can give to people. And the reason that we use mixtures is because it prevents allergies from getting worse. One of the classic things when people have allergies is that over time they become allergic to more and more and more things, or sensitive to more and more food. And the mixtures McEwen originally developed to prevent this recruitment, they call it in England, or spreading phenomenon. So that's why we use food mixtures, and food additives are in there, and food chemicals are in those mixtures. And in the inhalant mixture, it has all the pollens, molds, dust, animals, and so forth. So it's really a mixture of things that you're given. The enzyme that magically makes it work is called beta-glucuronidase. That's mixed with the material, and when you give that injection, it signals the local and regional lymph nodes to produce a very specific kind of lymphocyte in the bloodstream called a T cell. And in this case, it happens to be a T regulator cell, or it used to be called a T suppressor cell, that really regulates the activity of the other T cells in the bloodstream. And the other T cells, there's various kinds. One is called a T helper, and these are the ones that primarily produce allergies or sensitivities to various things, everything from ragweed to milk. By recognizing whatever the thing is, the substance is bad, and it tells the body to mount this big attack. And it's the T regulator's job to stop the reaction. And it does so in normal people, but in people with allergies or sensitivities, for some reason the T suppressors or the T regulators aren't doing their job. And all this immunotherapy does is produces those T cells by millions that suppress this inappropriate response to these various things. And of course, the nice thing about using a cell-mediated approach with T cells is they live a long time. So this treatment only has to be done every 2 months at first, usually for 6 or 8 treatments, and then people stretch out to 3 months and 4 months and 6 months and so forth, because the cells, as you know, with a half-life like uranium, some of the uranium is gone, half the uranium is gone in X number of years, and then in that same number of years, half of the remaining is gone, and that same number of years, half the remaining. So the half-life can be quite lengthy, even if it sounds relatively short. The cells can be around almost forever.
Yeah, that really is a distinct difference. The allergy approach by allergists involving those inhalants you were talking about is a completely different realm of the immune system. It deals with antibodies, and they don't live all that long. That's why that stuff needed to be given like every week or twice a week. Or patients were glad it was available, but it becomes rather cumbersome from the clinician and the patient viewpoint. Here with this LDA approach moving into cellular immunity, quite an advantage, wouldn't you say?
Yes, I think that's the basic major difference with regular immunotherapy. Of course, it doesn't work for food, but for things like ragweed and so forth, once you stop giving it, the antibodies fall off pretty quickly, and patients' allergies generally will come back to some degree, or totally after a year or two. LDA, the nice thing about it is that half of the patients in our study were able to stop completely after, usually an average of between 16 and 18 treatments, or over a period of about 5 years. So it has a distinct advantage in that it can be a finite treatment, and even those patients that have to continue it, like myself, for example, I still only do my treatments now about once every year and a half or so. I don't know when my last one was, and I'm still fine except for the cold that I have today. But it's really remarkably different, and I think majorly so in treating food problems and numerous autoimmune conditions that really can't be treated any other way except with heavy-duty immunosuppressant drugs.
I looked over the vast literature you put out. One of them that keeps capturing my attention is this list of 66 different conditions. And if I understand correctly, and please correct me if I'm wrong, when you did your 10,500 patient study, folks, that's monumental in this world of trying to put some study together. 10,500 is this unbelievable, as far as I'm concerned, generated from one man like you. You have 66 conditions that ended up being treatable with this. Probably didn't even know at the beginning that it could be. Talk about the vast range and wide scope of these diseases, many of which heretofore never were considered to be treatable conditions from an immunological viewpoint.
Yeah, well, there certainly were a lot of them, and of course I can't remember all of them.
Understood, yes.
As I get older, I'm lucky to remember 2 or 3 of them.
There were 66 of them there. I look at this list in amazement all the time. I brought it up to my listeners many times, too. I've actually put them into categories because they were sort of all over the board, but nonetheless, what a powerful statement to be able to bring to people who don't. There is no treatment out there for it. Think of those autoimmune conditions that you've already mentioned. No real treatment for it. All those GI conditions, like from mouth to anus, literally anything that could go wrong could be associated with food, huh? And by virtue of it, there could be an allergic reason for you to have all those symptoms. And correctably, through the use of LDA, people don't have to suffer from these conditions anymore in a high percentage of the cases. How? Tell me about the response rate. Maybe that's a good way. How if people listen to us right now and they're saying, geez, I wonder if that would work for me. Well, you did 10,500 patients. How did that break out? What percentage of people did get better or improved or whatever?
Well, I think overall the study data showed somewhere around 77 to 80% if you take all the conditions together, and some of the response rates. Some of these conditions we were sort of guessing at when we first started this treatment, and it turns out some didn't respond extremely well, like multiple sclerosis, for example. But the overall response rate was about 77 or 78%. When you look at the response rate of eczema or allergic dermatitis, almost of any kind, the response rate is way over 90%, for example.
Phenomenal for something that has no definitive treatment. Phenomenal. Yeah.
It's amazing.
It's amazing.
Go to the dermatologist and get their steroid creams and have to put them on forever until their skin thins and they can't use the stuff anymore. And there's actually a treatment that works almost all the time for it.
Now, when it comes to these injections, you say you currently, because you must have had allergies yourself, it appears that you responded, and at this point, you need to get one of these shots, just an intradermal. By the way, the word shot sometimes scares people. This is just an intradermal, a wheel, a bubble you bring up of the serum underneath the skin. You literally can see it sitting right there. So it's not a major, thrust into the anatomy, as the word shot may convey. But you take one of these so-called shots once every 18 months. Wouldn't you say, if you were plagued by serious dysfunction based on immunological response, by the time you only have to treat it once every 18 months, you really don't have the condition at all anymore to worry about, do you?
I would say that's close to true. It's not uncommon for people to get 100% better with this treatment. There are usually some lingering minor symptoms that don't totally go away or that start to come back, and that's how patients know they need another treatment. But it's dramatically better than it was when they started, and it's one of the reasons that we put so much effort into the study is to try and find questionnaires that really treated conditions fairly and get a level of response from people on how well they did. And people always tend to underrate their response to things when they come in, for example, I'll ask the patient, well, how are you doing? And they'll say, oh, I'm okay. I wish I were better, and I still have this problem. They list their 2 or 3 problems. The thing that happens is they don't list their 10 problems that are gone. But they do list their problems as they notice. So it was sort of a difficult study to design to get the perfect response, and I think the results are probably a little underreported because of that. But it's still dramatic.
Let me ask you this question, Dr. Schrader. For many who are listening to us right now and their antennae are up, they are really receptive to the intrigue, the allure of such a treatment as anyone would or should be. They're currently doing treatments on their own right now, getting various degrees of response, some of which allow them to just get by. How does the use of LDA treatment interplay or interfere, or does it interfere with current treatments? Can you do LDA and still march along with your current treatment so that you get the best of both worlds to try to find out if this works for you? Do you have to give up your treatment? One would say, great if you didn't have anything to treat anymore, but what happens in this interim between when you meet a patient and when you finally get to that 18-month mark?
Well, generally, people who are on traditional immunotherapy, which is basically very high-dose treatment that has certain risks involved, as you know, with it. But people that are on that have to stop it before they start LDA.
So if you're getting allergy treatments, these two don't work. You can't mix them both, okay?
Correct.
So you make a decision, a conscious decision, to move to LDA and give up your immunotherapy. That must be a problem for some, huh?
It's a problem, but most people that are on that type of immunotherapy that come to see me aren't doing that well on it, which is why they came to see me in the first place. So most of them don't mind stopping a treatment that's not working all that well. And generally, LDA will work quickly enough, very often, even with the first treatment, so that they get enough relief so that they know, wow, this is really going to be helpful for me.
Now, that's with someone who has an existing inhalant kind of a problem and is being treated by an allergist. With that long list of 66 conditions, so many of which aren't even attempted to be treated by the allergist, I'm talking about the autoimmune disease. I'm really referring to the GI disorders. People are taking all sorts of prescription medications. Do you have to quit taking those meds in order to do LDA?
Very often you don't. Sometimes you do. There's a booklet that's available for patients that we use for all of our patients that lists the medications that they're taking that may interfere. For example, regular antihistamines, like the ones that are available over the counter and by prescription that people take for allergy, do interfere with the treatment. So you can't use those for the 3 weeks after your treatment every 2 months or so, because they interfere with the development of the T cells that we're looking to stimulate. So there are certain medicines that have to be avoided around the time of the treatment for that 3-day period. Usually we try and get patients off of all their medications that they can stop because of the theoretical risk of sensitizing to those medications, although we've never really seen that. So patients who really have to take a daily medication usually just take that all the way through if they can't do without it. If it's a medication that interferes severely, like aspirin, for example, then we find some suitable substitute that they can take for those 3 days, or that they can take during the 3 weeks after the treatment where they can't take certain other medications.
That 3-day period, the so-called LDA diet, and now including the issue of certain medications, this is a tried and true way to make sure that the day before, the day of, and the day after, no allergens are going to bombard the patient's system that you're going to be a sort of allergen-free other than the ones administered by the serum. Is that the idea behind it?
That's the idea with EPD and LDA, that the exact dose of each material that you're getting, each food that you're getting, is very precise. So McEwen's research really looked into the various doses of all this material, and he found the optimal doses and the optimal combinations of things to use to desensitize people. So his idea was that if you're going to give this precise a dose, it might be harmful for the patient to be eating certain foods, and it turned out that that was usually the case. So he came up with the LDA diet, which, as you know, is very limited for that 3-day period, with foods that he found over a period of years didn't seem to interfere with the treatment.
And I found that I had to get my first injection just last week myself. That diet composed really of foods that are sort of strange, that aren't common foods. I think that pretty much is how you got to look at it. You found foods that you can eat and get through over those 3 days that really have a low immunological potential, okay, to provoke immunological response. And I did quite well for those 3 days. Most people do. And every time you get an injection, if it's 2 months later or if it's a year later, every time you're going to get one, you have those 3 days to contend with where you're on an LDA diet and your issues of whatever meds you may be on are an issue at that time, correct?
That used to be totally correct. Nowadays, there are some doctors around the country who are treating primarily autistic children with this treatment. And as you know, autistic children are very limited sometimes with their ability to eat certain foods. So there's one doctor in particular in Maryland who's treating autistic kids, and he's not having them do the diet. So they're eating their regular foods, the foods that they'll eat, so they don't starve to death. And they seem to be doing well for the most part. I think adults probably don't do as well if they don't do that, and sometimes do horribly if they don't do that. But at least he's found that his autistic kids can get away with eating other foods that maybe other people can't. So the diet is recommended by most of us who do this, but there are a few doctors who are experimenting with other foods and seeing how well people do.
So there's more information to come. We're still in the baby stages of this LDA, or not. I mean, when you figure that you put this in play, you said, I think, 2001. Hey, this is 10, 11 years later. This is still knows what this may morph into. Wouldn't you agree?
I would think so. I mean, we know by now that it's very safe, that it works most of the time, but there are always new things down the pike. And there's a very interesting doctor by the name of Ty Vincent in Alaska that you heard.
Yeah, he's very interesting to say the least. Sure.
Yeah, Ty's a great guy, and he's a maverick. He likes to try things, and so he's actually using various extracts of bodily fluids to treat certain conditions. For example, he actually will use stool, which obviously you can sterilize before you give it, for treating certain almost impossible to treat conditions. And I've been excited about that for the past 2 years, because that's taking the molecular mimicry model the next step. And the big deal with LDA is the dose of whatever you're using has to be very close to perfect. And he spent the last couple of years trying to find the doses of these bodily substances that usually work for these very extremely difficult conditions. And I think he's done a good job, and I'm about ready to jump in myself with treating some extremely resistant problems with some of Dr. Vincent's methods. So it just shows that there is a lot of room to advance this, and who knows what's going to come down the pipe.
Well, you must feel very good when you see the Dr. Vincents of this world emerge to take this therapy and take it to the next step. I want to say that I'm so thankful that you took the time to interrupt your day at the beginning of it to come aboard with us, that the LDA concept is gonna thrive here in Western Pennsylvania, and hopefully maybe you'll allow me to interfere with you some other time in the distant future. Fair enough?
Well, it's very possible, Dr. Courtney, and thank you for having me on. It's been my pleasure.
Take a short break. Be right back in a moment.
Talk Radio 1320.
Hello, Dr. Dennis Courtney here. Do you or does someone that you know suffer from serious eye disease? Is your vision deteriorating and hampering your ability to drive a car, especially at night? Is your peripheral vision closing in on you? Or how about having to turn your head to the side just to see something directly in front of you? If this seems familiar to you, you'll be happy to learn about a way to restore your vision loss even when your eye doctor may be telling you that nothing can be done. Take the time to find out how you can restore your vision at the Pittsburgh Eye Division of Courtney Medical Group, located in McMurray, Pennsylvania. It's all part of what we do at the Pittsburgh Eye Protocol. To find out more, you can go to our website at www.pittsburgheyeprotocol.com. You can listen for an announcement for the next free seminar that we offer so you can learn more, or you can just call us at Pittsburgh Eye Protocol. The number is 724-993-0500. That's 724-993-0500. And keep listening on weekends at TW3.
Talk Radio 1320.
Good morning, everybody. Welcome back to the Weekend Wellness Workshop. We're here with you discussing a very fascinating topic this morning. The subject, LDA. Those letters now actually should mean something to you. They certainly now mean something to me. And, of course, they stand for low-dose allergy or antigen therapy. You can put either one in the A category. And, of course, having the opportunity to bring to you the godfather of LDA therapy, named Dr. William Butch Schrader, is certainly an honor and a privilege, and I hope you enjoyed hearing from him, how it all got started, and really where it has ended up now. I should say, we're going to take another break here in just a second for the news, but to find out more, as I tell every patient that I see in my office, to find out more about LDA, if this is a treatment that you're interested in and want to learn more, I'm going to suggest you do two things. Number one, go to the Dr. Schrader website. His website is Dr. Schrader, that's DR without the period at the end, Dr. Schrader, SHRADER, drschrader.com. There you will find the best written explanation that I know of on what LDA is and how it got started and all the little nuances that only Dr. Schrader was there to be able to describe and has done a very good job. Once you have read the written word, you may want to listen to the spoken word. And, of course, we launched LDA treatment in my office way back in November of 2012. It was a pretty special event. We thought enough about it that we declared every Friday in the months of November as LDA Friday. And so if you go on back to view them and listen to them, go to my website at djcmd.com. On the opening page, click on the icon marked Archives. That takes you onto our YouTube channel, and just keep on scrolling back and back until you get to November of 2012. The very first week, you'll find the Dr. Schrader interview right there. The one you just heard is right there, so you can hear a repeat of it. The very next week, which had been on the 9th, Dr. John Wyckoff came on the show to talk about the use of LDA with autoimmune disease. The third and the fifth week, because, of course, Thanksgiving was sandwiched in there, we had a very interesting discussion with a naturopathic gastroenterologist from the West Coast. Her name is Kathleen Janelle. And for the myriad of GI issues that result due to allergic response, you do not want to miss the opportunity to listen to that. So these are the places I send my patients when I see them. These are the places I'll send you as my listener today. You can find out more about it. What we're going to do is take a short break.
When we come back, I'm going to take us to the top of the hour with some more information. How do you need to take a look at LDA? Why do you know it would be a treatment for you? How is the treatment done? All those when we return, and we'll be right back in just a moment. Good morning, ladies and gentlemen. Welcome back once again to the Weekend Wellness Workshop. I'm Dr. Dennis Courtney with you today, and we're talking about allergies, allergic response. In some cases, it's so clear to you that you have allergies that to even question that you could be suffering from anything else would be a little ridiculous. In other cases, what I intend to be able to maybe convey to you is how you're feeling and how lousy you're feeling might very well be due to allergic response, and you're never going to be able to put it together. And you'll see what I mean in just a moment. A couple things I want to finish up when talking about this LDA in general. One is LDA is known by Dr. Butch Schrader, who brought it to us. And I used to use the number 90. I have to change my my calculation. There used to be 90 doctors in the entire all the entire United States who are trained in LDA. I found out just yesterday the number has jumped to 123. However, taking a look at that in the long view, that's really not many doctors that you could go to get this kind of therapy. The fact that we offer it here is a real bonus, and we're so pleased to have been there for the last few years in providing LDA treatment to our patients. And the one thing I also want to get across is that the conventional medical community doesn't know anything about LDA. So I know you might like to go to your nice doctor and say, well, let me ask my doctor what he thinks about this. And I think you're going to get returned with a blank stare. LDA won't mean anything. He won't know what the letters are. You have to tell him. And it's probably not the source to go to get valuable information on decisions that you may have to make for you. You need to educate yourself, and I've just given you the very ways to do it, and it'll be helpful to consult with you to make you even more comfortable with it. The final thing I'd like to say in terms of the overall treatment is this treatment, and I don't think it was mentioned enough in our interview with Dr. Schrader, is extremely safe. And I want to underline the word extremely. And the reason why it is so safe is that the mixtures that we use, we're talking about those mixtures of inhaled and foods and chemicals, they are at a dilution of 10 to the 17th. That's 3 short of homeopathic. At a dose that dilute, there has never been any patient in all these years since 1993 that has ever suffered from any consequence, severe consequence to the use of LDA. I say none. 0, zip, and nada. And at that dilution, 10 to the 17th, there's never going to be. Now, I should mention, because we've talked about our friend the allergist enough, we probably need to make one final point that I think, when talking about safety, needs to be mentioned. Now, the allergist does his dilutions at 10 to the 5th. And let me describe what 10 to the 5th means, and then you'll understand what 10 to the 17th means. So you have 5 columns of water sitting in front of you. Each column is 10 millimeters of water. And in the first column, you put 1/100th of 1 ml of the allergen in there, and you shake it up. Now, it really diluted that thing pretty good, didn't it? So from that first vial, you then take 1/100th of 1 ml and put it in the second vial and shake it up. That's pretty much more dilute, is it not? And you do the same thing by taking 1/100th there and put it in the third, and it just keeps going on 5 times, 10 to the 5th. So you're thinking, as I thought, heck, that's really dilute. Turns out that's not dilute at all. In fact, immunologically speaking, that is a whopping dose of allergen. And there are many cases over the course of history where a patient went to their allergist's office to get their first injections of their allergy treatment, which was a serum made up by reading the skin testing of that individual, and the serum is at 10 to the 5th now, however many allergens are in there. And very unfortunate for the patient, they died. Okay, they died in the waiting room because 10 to the 5th is too much. 10 to the 5th is whopping. And with that in mind, bringing back the concept of 10 to the 17th should now take on a different perspective. You got 17 columns of water lined up. And you do that thing that I just talked about 17 times. And that's 3 short of homeopathic. It is so dilute. It cannot and will not harm you. And I think it was a point that I wanted to make to allow you to be certain that you're not moving into some sort of a experimental treatment where you have to take a risk. There's no risk here. The other thing to say, of course, is that with mixtures of that magnitude so low, the immunological responses that they provoke are unchanged. So you can get the ability to form those cells, we call them T suppressor cells, with a solution that's that dilute, and being able to achieve the goal, the treatment goal for why you're doing the treatment to begin with. The final thing I'm going to say about the whole group of things that we treat with LDA is what came up in an interview with Dr. Schrader. I call the group of conditions the list of 66. And I would encourage any one of you listening to me today, when you go to Dr. Schrader's website, and once again, that's drschrader.com, on the opening page, on the top bar, you can find LDA up there and click on it. But along the left-hand column, there's a little icon marked Things That We Treat. I suggest you click on it, and up will come the list of 66. Read through that list, and you will find things you never even imagined could be caused by allergic response. They very well may be revealing a picture of you and some of the things that you're suffering from, and to think that they are treatable with LDA is the first bit of information I want to pass to you. And the final information I want to pass to you is to make that list, you had to have had at least a 78 to 80% success rate in treating every one of those 66 conditions, or you didn't make it on the list. That's phenomenal, especially when you read that list, and I'm not going to go into the list today, but it now gives you the tools by which to take a look at your own situation, even if you are not sure you have an allergy. We'll talk about that in a moment. I think in many cases, if these are delayed hypersensitivities, you're not even going to think it's an allergy when in fact it is. So with that information, let's start talking about how do you know, or how would you think that LDA should be a treatment for you? I think it's a fair question to put out there for you, and I jotted a couple points down that I think should allow you to make that decision. The first is the one that really doesn't take, it's a no-brainer. If you're already seeing an allergist and you're getting those injections from the allergist once a week, if that's okay with you, keep right on going. I think especially if you're getting great responses, sometimes it's really bail out of one thing that's a for sure. But this thing about once every week injections, I think gets old, especially when it's envisioned that you will have to have one injection per week for the rest of your life. If that's okay with you, I'm with you, and I will say to you, keep on doing what you're doing. If, however, you're seeing that allergist once a week and you're not doing well, and he's not able to get enough resolution of your symptoms, then I believe that's also a no-brainer. And why would you want to continue a series of injections that has never really worked for you?
when in fact there's another way to correct this. Okay? And so that's the person that I think needs to think about LDA. Now, when you actually, as a person listening to me, have made an association between a substance and a disagreeable response that you have, that's clear, whether you're seeing an allergist or not, that it more than likely is due to immunological response, and whether it's something you inhaled that caused you to sneeze, or something you eat that immediately causes you to be feeling ill, or exposure to chemicals that may do the same thing, either of these three, I say, is a no-brainer. You absolutely should consider getting starting the LDA approach. Now, this certainly brings in a discussion that is worthy of to be discussed right now, and that is this difference between immediate and delayed hypersensitivity. Immediate hypersensitivity allows you to literally be your own doctor. Because if you made the association between any substance, whether inhaled or consumed or exposed, leading to a set of symptoms, why do you need to belabor that point any further? You absolutely have a way to correct it. And now that you know that the allergist could only deal with the inhaleds to begin with, if your issue was a food, you were totally out in the cold. And by the way, if you have a food that you are having such exaggerated response that could be called an anaphylactic response, what about those people who are allergic to peanuts? Or those people who are allergic to shellfish? One bite of a peanut could literally send them to an emergency room. You are not allowed to be treated by an allergist for that. But you can be, I repeat, you can be treated for immediate hypersensitivity reactions with a dilution of LDA of 10 to the 17th. Now, I want to talk about the level of response that you really can't associate with. And they have to do with delayed hypersensitivity reactions. So let's think about this. You consume a food, and when you eat that food, nothing happens to you. Like, you're fine. You're okay. However, because it's a delayed hypersensitivity reaction, 4 or 5 or 6 days later, you begin to experience bizarre symptoms, and you, I believe, it's safe to say, are never going to see the relationship to something you ate 5 days earlier provoking a set of complaints that you have today. If you can do that, you're a special person, and I don't think many people can. So if you have a bizarre set of symptoms, and you can't seem to explain why in the heck you should have them at all, and you know that you stumped the band every time you went to visit any one of your doctors who looks at you with a very whimsical look saying, I don't know, you're the very person that needs to be considering delayed hypersensitivity reactions, and with LDA, whether or not your response is immediate, and you'd be a dummkopf not to know that you have an allergic reaction, or if it's delayed, in which you'll never know that it's an allergic reaction. It's just the symptomatology, in that case, that's unexplained, that warrants, why shouldn't you try LDA? It is absolutely a safe treatment to pursue. With that 10 to the 17th mixture, you cannot be hurt. Okay, let me do this. I want to take one final break and then come back and talk about the actual protocol for doing LDA, sort of explain to you how that works around here, and getting you set to literally call up our office at 724-942-3002. If you think you may be interested in it, be right back in a moment with the final segment of our show.
Pittsburgh's Talk Radio. 1320.
Hello, Dr. Dennis Courtney here, host of the Weekend Wellness Workshop and medical director of the Courtney Wellness Center. I hope that you enjoy the show and the opportunity to learn what's available to you to make a real difference in your health. As a trained medical doctor, I'm well aware of how conventional medicine works. You go to your doctor with a problem. Your doctor puts you on a drug to alleviate the symptoms of the problem. You come back to further discuss the same problem, which usually continues without change, or the next new problem that gets added to the list. And then you go through the same process again. Don't you think it's time to stop the madness and take charge of your health and actually fix the things about you that won't allow you to feel optimal. The things that we discuss here on the show are things we actually do at the Wellness Center. They never require the use of drugs. They actually can and do correct the causes for why you're having those uncomfortable symptoms. Call the center so that we can discuss how we can get you feeling optimal again. Schedule a consult today. Call us at 724-942-3002. That's 724-942-3002. And keep on listening to us here each and every week on TW3.
Pittsburgh's Talk Radio, 1320.
Good morning, folks. Welcome back to the Weekend Wellness Workshop. We're here in that final home stretch, talking about a subject of LDA, low-dose antigen therapy. I think we've covered this topic extremely well today, and certainly listening from the guy who brought it to us, Dr. William Butch Schrader, I think is a highlight of the show and puts it in the platinum category as far as I'm concerned. To sort of be the final point of what you would maybe want to know about if you're considering LDAs, how it is that the protocol to get up to the injections works. So let me take you through a few steps. They're not many, but at least it will be the final clarification for what may be a little unclear to you. The first is, all this starts with a consult with me, where I sit back and listen to the complaints that you have, and what I'm trying to do is to see which one or ones of the mixtures I'm going to need to use. Now, you may clearly have a food allergy, and you know it, and I, of course, will agree with you that I know it, and there's no doubt about it. You're going to get the LDI mixture for foods, and we're going to correct the problem. But I need to make certain, if we're going to do this, that you don't have an overlapping inhalant issue. And when I get into the discussion with the patients, literally I find out, oh, yeah. In fact, I've heard some say, oh, I used to get allergy shots for hay fever. These are red flags to me that says we're not just doing foods, we are doing inhaled allergies also. And similarly, the same thing may occur with the chemicals. So I've got to make a final decision on which one or ones of the mixtures to use. And with that consult, I'll be able to make that call so as to set the parameters for our first injection. The next issue is been an interesting one. You see, Dr. Schrader has developed a very stringent set of guidelines. He refers to as his pink book, and in that book it spells out what foods you're allowed to eat, what medicines you're allowed to take, and these rules, I believe, are very strict. By the way, sometimes so strict that patients just said to me, you know what, I don't even want to do this. I don't see why it should be that definitive, but they felt that it was just too onerous. So with Ty Vincent, and you're going to be learning more about Ty Vincent next week, we found out that we have a new first rule. And the new first rule is there are no rules. There is no diet to be mindful of. There's no discontinuing any medicines. You continue to do what you want to do. And so the first rule is there are no rules. The second rule is, after any one of these LDA injections, which we are going to administer in the intradermal area of your forearm, and by the way, I should mention that for kids, this is very traumatic, and we do a we just deposit the stuff sublingually, and we don't inject. Kids go through the roof. This gets a little trying for both parents as well as certainly for the little child. So we can do this another way. We do not have to inject it intradermally. For an adult, that's not a big deal, but for a child, it very well may be. And so to getting these injections, then, clearly it's going to be administered in the dermis, which is where that dendritic nervous system resides. Now, what has to happen? Something needs to change within a few days to a week after the injection. The worst thing you can tell me is, I got the injection and nothing happened. I'll take something good happening or something bad happening, meaning an accentuation of your symptoms, because that means we have the right antigen and we'll get it worked out. But to me, no response is the inappropriate response. It's the one that I have to question what I'm doing. And the second rule is that something better happened after either one of the first two injections. Because if nothing happens at all after the first two injections, the third rule is we go back and we do all the rules and start over again. So that you're going to have to obey the diet at that point. You're going to have to discontinue certain meds. You're going to have to get bowel preps. There's a whole bunch of things that need to be done if you show no response by the end of the second treatment. The reason why this came about is after we started to have no rules, a couple patients who have been patients of mine has said to me, you know what, I did much better when I got this injection with obeying all the rules. And so I'm electing, I the patient, am electing to go back from this point forward and do it with all the rules because I know that it's a greater benefit to me than doing it without the rules. And it's because of that type of interaction between myself and my patients that I said, absolutely, go for it, and it allowed me to develop these 3 new rules. Of course, the next rule is we're going to continue to do these injections once every 2 months because the half-life of the T suppressor cells that we're forming is 90 days. We're coming in before the 90 days at 60 days, and we're going to do this for 1 year, 6 treatments before we finally open it up. And by opening up, I mean no longer are we going once every 2 months. We'll go once every 4, then maybe once every 8, and then by the 3rd year, maybe once a year. That's the way it should work out, folks, and hopefully we'll have that kind of response in you, allowing you to correct your allergy and do something you never thought you were going to be able to do, actually not worry about giving up that food, okay? Some people complain about, I can't eat anything. Well, once we correct your food allergies with LDA, you'll be able to eat anything you want because we will have shut off that response. So, this is how LDA should work. We hope that we've given you the opportunity to learn about a new therapy, very unknown to the conventional community, well known to the alternative community, and certainly well known to this office. If you'd like to be a part of this, come on in to see us. Give us a call at 724-942-3002, and we'll have that first consult and get you set up to start your LDA treatments. Now, a couple things as we're closing that I think I'd probably like to give you your attention. I mentioned at the beginning of the show, I'll see you in Cheswick, folks, on next Thursday night, this coming Thursday, the 29th. Don't forget, Dr. Thomas Levy, the author of the book, The Toxic Tooth, who was our guest last week, is going to be in town. And you don't want to miss that presentation. I'm dying to see the slide presentation that goes along with all of the points he made on the show. The toxic tooth, how a root canal could be making you sick. I said at the beginning of the show, how a root canal could literally be killing you, and I meant it. You got to find out, folks. These root canals are not a good thing at all. Number 2, you can call up if you have eye issues and would like to start to learn more about our eye treatment programs. Head to the website which manages our eye issues, and it's called the PittsburghEyeProtocol.com. That's PittsburghEyeProtocol.com. On the opening page, you'll find a little box to fill out to request a special book. The book is written by Dr. Ed Conrad. It's called The 10 Eye Essentials. Hope you enjoy the book. It will get you started on how you can actually begin now to start reverse these very serious retinal diseases that you believe cannot be reversed at all. And, of course, you hear me talk about the 3-day programs. I mentioned once again our November program is going to be on November 16, 17, and 18. If you'd like to be involved with it, give us a call after you go to the website. And you want to talk to Sarah. The number is 724-993. 724-993-0500. That's 724-993-0500. The final thing I want to say is we've now laid the groundwork for another doctor to make an appearance here. And it
he'll be just an excellent doctor to pick up where Dr. Schrader left off. Actually, Dr. Schrader mentioned him during the closing remarks that he made. He's the doctor from Alaska named Dr. Ty Vincent. And he has come in and completely revolutionized how LDA can work. He's revolutionized it so much, we actually call his contribution LDI and don't even refer to it as LDA, and LDI standing for low-dose immunotherapy. Well, this doctor we'll have with you next weekend to talk about all the other diseases outside of the classical allergies, which is where we pretty much resided today. There's so much more benefit to LDA treatment, now known as LDI, that you just got to hear about how things like Lyme's disease, vitiligo, acne, Wegener's granulomatosis, psoriasis. The list goes on and on and on. If you'd like to learn more, you'll want to pay attention to our show next week. Dr. Ty Vincent will be our guest. I want you to have a wonderful week. Look forward to seeing you on Thursday night up there in Cheswick. That's going to be at the American Slovenians Association. Get off the turnpike at the High Valley exit. Stay in the left lane. Proceed north on Route 28. Go to the first red light. Don't turn. Just go to it. And the very next road on your left, turn left, 2 blocks in. I'll see you there. So long.